You know that moment when you bite into something cold and feel a sharp zing in your tooth? Most of us just brush it off. We tell ourselves it's nothing, that it'll go away. But here's the thing. Your teeth are trying to tell you something important, and most of us are completely ignoring the warning signs. Today, we're going to talk about the early signs of cavities that you're probably missing right now, because by the time you can see a cavity, it's already been developing for a while. But if you catch it early, you might actually be able to reverse the damage. Let's start with something that almost everyone experiences but rarely takes seriously: tooth sensitivity. When your enamel starts to break down, the layer underneath, called dentin, becomes exposed. Dentin has tiny tubules that connect directly to the nerve of your tooth. So when you drink something hot or cold, or eat something sweet or acidic, those sensations travel right through those tubules to the nerve. Here's what most people don't realize. This sensitivity is your tooth's early warning system. It's telling you that the enamel is compromised and bacteria are starting to win the battle. If you're experiencing sensitivity to cold drinks, ice cream, or even just breathing in cold air, that's not something to buy special toothpaste for and forget about. It's a sign that you need to see your dentist. Now let's talk about something even more subtle: a chalky or rough feeling on your teeth. Run your tongue over your teeth right now. Do they feel smooth and glassy? Or do some spots feel a little rough, maybe slightly chalky? If you notice areas that don't feel as smooth as the rest of your teeth, that could be demineralization, the very first stage of tooth decay. This happens before you get an actual cavity, and it's actually reversible at this stage with proper oral care, fluoride treatments, and dietary changes. Here's another sign that people constantly overlook: white spots on your teeth. If you notice new white spots appearing, especially spots that look chalky or dull rather than shiny, that's a red flag. These white spots are areas where the enamel has lost minerals and is becoming weak. They're essentially pre-cavities. The enamel is still intact, but it's damaged and vulnerable. Think of it like a crack in a windshield. Let's talk about something that happens to almost everyone but gets ignored constantly: occasional toothaches that come and go. You bite down on something and feel a little twinge of pain, or you have a dull ache in a tooth for an afternoon, but then it goes away, so you think it's fine. This is one of the biggest mistakes people make. Pain that comes and goes often means the problem is in an early stage, getting worse gradually. When a cavity is forming, it doesn't hurt all the time at first. It hurts intermittently. Every time you ignore one of these episodes, you're giving the bacteria more time to dig deeper into your tooth. Eventually, the cavity will reach the inner pulp where the nerve lives, and that's when you need expensive treatments like root canals instead of simple fillings. Another sign that people completely miss is a change in how their teeth fit together when they bite down. You might notice that when you chew, food gets stuck in places it didn't before, or your bite feels slightly different. This happens because as enamel breaks down, the surface of the tooth changes. If you're suddenly using dental floss or toothpicks more often because food keeps getting trapped in the same spot, that's worth investigating. Here's a sign that's really subtle but incredibly important: bad breath that doesn't go away. We all have bad breath sometimes, but if you have persistent bad breath even after brushing, flossing, and using mouthwash, that could indicate decay. Cavities are caused by bacteria, and these bacteria produce waste products that smell bad. If you or someone close to you has mentioned that your breath has changed, it's time to see a dentist. Let's talk about something that seems completely unrelated: changes in your saliva. Have you noticed that your mouth feels drier than it used to? Saliva is one of your mouth's best defenses against cavities. It washes away food particles, neutralizes acids, and contains minerals that help repair early tooth damage. When you don't have enough saliva, your teeth are more vulnerable to decay. If you're experiencing dry mouth, increase your water intake and talk to your dentist about products that can help. Here's another sign: discoloration on the teeth that isn't on the surface. If you notice that a tooth or part of a tooth looks darker, more yellow, brown, or even grayish, and the color seems to come from within the tooth rather than being a surface stain, that's internal discoloration from decay penetrating through the enamel into the dentin layer. Now, let's talk about something that happens with back teeth specifically: roughness or small holes in the chewing surfaces. If you run your tongue over your back teeth and feel that the grooves seem deeper than they used to, or you feel tiny pockets or holes, that's often where cavities start. These are hard to see because they're on the top surface of your back teeth. Here's something that happens gradually: your teeth appearing longer. This isn't about your teeth actually growing, it's about your gums receding, which exposes the roots of your teeth. Root cavities progress faster because the root surface is softer and less resistant to decay. If you notice that your teeth look longer, or you can see yellowish areas near your gum line, you need to address this. Let's talk about something that people notice but rarely think is important: a change in how food tastes. If you're biting down on food and suddenly notice that it tastes bad or bitter, especially when you're chewing on one particular side of your mouth, that could be decay. When bacteria break down your tooth structure, they create acids and waste products that can affect how food tastes. Here's something that seems backwards: decreased sensitivity. When a tooth that was sensitive suddenly stops being sensitive, it can actually mean the decay has progressed deeper and the nerve has died. This is why sudden relief from tooth pain without treatment is actually concerning. If you had a sensitive tooth and the sensitivity suddenly disappeared without any dental intervention, you need to get it checked immediately. Here's another subtle sign: difficulty flossing in certain areas. If your dental floss keeps shredding or getting stuck in the same spot every time, that might be an early cavity. Cavities create rough edges and holes where floss can catch. If this is consistently happening in the same place, that area needs closer examination. Let's talk about pressure sensitivity. If you notice that pressing on a tooth or biting down on food with a certain tooth causes discomfort, that's significant. Cavities can cause structural weakness in the tooth, and when you apply pressure, you're essentially pressing on a compromised area. Here's the thing about all these signs: they're your body's early warning system. When you catch cavities at these stages, treatment is simpler, less expensive, and less painful. We're talking about possibly reversing the decay with fluoride treatments and better oral care, or at most needing a small filling. Compare that to waiting until you have severe pain, which might mean you need a root canal, crown, or even extraction. Dental decay doesn't heal on its own. Your body can repair early enamel damage if you give it the right conditions, but once a true cavity forms, that hole doesn't fill itself back in. It only gets bigger, and the longer you wait, the more complex and expensive the treatment becomes. So what should you do if you're recognizing any of these signs? First, schedule a dental appointment as soon as possible. Be specific about what you're experiencing. Second, upgrade your oral hygiene routine. Brush twice a day for 2 full minutes each time with fluoride toothpaste. Floss every single day. Third, pay attention to your diet. Every time you eat or drink something sugary or acidic, you're feeding the bacteria in your mouth. Try to limit sugary and acidic foods, and when you do consume them, rinse your mouth with water afterward. Fourth, stay hydrated. Drinking water throughout the day helps wash away food particles and bacteria. And finally, stop ignoring the signs. Your teeth don't hurt or feel weird for no reason. By catching these early warning signs, you're potentially saving yourself from hours in the dental chair, thousands of dollars in treatment costs, and a whole lot of pain. Your teeth are meant to last your entire lifetime. With proper care and attention to these early warning signs, they can. Don't be one of those people who ignores tooth sensitivity for months or years until the tooth needs a root canal. Be proactive. Be observant. Your future self will thank you.